CDC is clearing up confusion over its COVID guidelines. The agency recently changed its recommended isolation time if you test positive. But the new advice has left a lot of people with questions about what they should be doing. Alex Littlehales has the latest update from the agency's director.
At a time when accurate information has never been more important, the CDC spent Friday morning clearing up its message.
What we're saying is on day 5, do you still have symptoms?
Clarity is what media organizations across the country asked of CDC Director Dr. Rochelle Walensky. Even though COVID cases are still on the rise from the Omicron variant, the agency lowered its recommended quarantine time if you test positive from 10 days down to 5. Now, schools, businesses, and other institutions are looking at this guidance for better direction. In a teleconference Friday, Walensky clarified that under its new guidance, it's best to think of the first day of symptoms as day 0. By day 5, people with symptoms should stay in isolation, but those without any may leave the next day, as long as they wear a mask for at least 5 days afterwards.
Day 6 through 10, if your first day out is day 6 through 10, you should really wear a mask and anticipate that you might have some residual contagion.
Walensky says some kind of action was needed, because as the Omicron variant spread, previous quarantine protocols had put a major strain on the country's hospital systems. These new guidelines could help ease those staffing issues.
Unlike prior waves in this pandemic, is not that we don't have enough beds, but that we don't necessarily have enough staffing for those beds. And we were really seeing hospital healthcare work staffing as a real challenge.
In Norfolk, I'm Alex Littlehales for 13 News Now.
CDC says it's not clear yet if testing positive for Omicron means you're protected from getting it again.